You're gonna.
Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and MediSpa. Welcome again to one of our monthly Facebook Live events, and we're glad you're participating. So tonight, the format's going to be a little different. I have with me Tara, our esthetician, and Pamela, our nurse injector. And tonight, we're going to be completely informal. We'd really like the audience to give us our comments and also ask any questions that you want. You have all three providers from Bellissimo Plastic Surgery and MediSpa, so we are at your disposal tonight. To sweeten the pot, we have a chance for you to win a spa facial. And to be able to qualify for that, you need to leave a question through our comments section, and you have to be watching live at the end of the show as we pull the name. So with that, we will kick off tonight's event. We were kind of talking about some of our favorite procedures before we started, and we recently, I had Pam and Tara in with me while I did a facelift, and facelifts and eyelid surgeries are becoming some of my favorite procedures to do together. We'll talk about some other ones I'd like to do maybe later on if we have time, but facelifts and eyelids together is a tremendous surgery for me. I enjoy doing them, but it really gives somebody that confidence and just sort of gives them that rejuvenated, refreshed look. It builds their self-confidence again, and so I really enjoy doing them. If anybody has any comments about that, I'd love to hear them. Again, that spa facial is waiting for you. So I was just going to turn it over to Tara and Pam, and they can give you their comments. And Tara has some interesting things because after a facelift, one of the myths about facelifts is you don't need to take care of your skin anymore. You don't need to use Botox anymore. You don't need to use dermal fillers. So that really isn't true. In a facial rejuvenation scenario, surgery is just one of the main components to it, but as these ladies will tell you, their part of it is just as important to give you the longevity of the facelift and also to fill in some of the things that the facelift doesn't do. The texture of the skin, the small lines or rhytids that we call rhytids on the skin or in the face that are not corrected by a facelift. Also, with some of the injectables, you can revolumize some of the areas like the cheek or take care of lines across the forehead with Botox. Again, one of the myths about a facelift is that everybody thinks it's from the top of your head to the bottom of your neck, and that really isn't true. It kind of emphasizes right in here, the lower 2/3 of the face, along the jawline and the neck. So the eyes and the forehead are not part of that procedure. They can be added as an eyelid surgery or a brow lift. So as the ladies were watching the other day, and then they can kind of tell you what they saw and what they can add to what I did. So I'll kick it off to you, Tara.
Okay. What I thought was very interesting was the layers of skin. So when I actually got to see how he separates the two layers, the epidermis and the dermis, which is below it, we see the epidermis. And that's what, when people come to me, I really work on exfoliation, their texture, any correction like brown spots, pores, acne, anything like that. But when I actually got to see when he cut there, that I could see the dermis underneath there. And that's actually where our collagen cell is. And our collagen cell is responsible for elastin in the skin. So typically around age 26, we start to lose our collagen. We're always producing collagen, but typically around age 26, we start to lose collagen. So it's so important. All the anti-aging treatments out there basically are to stimulate the collagen cell. So that's where our medical grade products come in. There's a lot of marketing out there that tells you that the product does penetrate down to the dermis and stimulates the collagen cell. And you really, really need a prescription strength to actually get down in there. And it's very important to start at the bottom because that's where we lose it up top and that's what we see. So I really liked that part of it. It really, really just visualizing it made me understand, even though, you know, that's what I always talk about with my patients and things. So,
Erin asked, can you get a facial if you had medical Botox?
Yes, you want to wait 2 weeks after though.
Yes, we recommend waiting 2 weeks to let the product set into place so you don't manipulate it and move it out of the area that it was just injected.
You could also do a facial prior to the Botox, and then that wouldn't manipulate the Botox.
That's
Right,
correct.
sometimes that's what we do. We'll schedule, they'll come to me, and then right after they go over to Pam, which is nice.
And I also have another question from Sarah. Is it becoming more popular for people to get fat transfers to the face to add volume? How long does it last? And if you lose weight, can that also cause you to lose fat that was transferred?
So that's a great question. Fat transfers have been around a long time, and it is a good time if you're considering some fat transfers or just volumizing parts of your face. The areas that are really targeted at the time of a facelift are up in the cheek areas and sometimes along the lips or even in the nasolabial folds, this line that forms around your mouth. So it is a good time to do that. What is not part of the marketing for fat transfers, though, is that fat transfers, you're transferring live tissue. So fat has its own blood supply, it's alive. You're going to transfer from one area, most of the time it's from the belly or the thighs, and you're going to transfer from one area to another. That fat has to reestablish a blood supply or it doesn't survive. Also, the studies show that whatever a surgeon injects, about the best that we get is about 70% of what we inject actually gets a blood supply and survives. The rest of it can be reabsorbed. So there is a small chance you would have some asymmetry, because if I'm putting in fat on both sides of the cheek and I have a little bit more take on one side versus the other, you may have a little bit of asymmetry. That's usually a minor problem. It also could be that the fat doesn't take very well. So if you're considering it, really sit and talk to your surgeon, find out how many times they've done it. There's also some ways to optimize it. I still think that for most people, the injectable collagen sort of products such as Juvederm and Voluma are actually tried and true and just as good for as fat transfers. Fat transfers last longer, and they should last a lifetime. And to answer your other question is, if you gain weight, yes, that area will gain weight, and if you lose weight, you can lose weight in that area as well, because the fat that you transfer acts like the fat from which you took it, not from the area that you transfer it to. So it acts more like belly fat than it does facial fat. So, but it's a good idea to really talk to your surgeon about it. It's something that I like to do, but I don't do it for everybody, and it has to be a special case. And I think Pam can really allude to the fact about the dermal fillers.
First, though, Tracy wants to let Tara know your hair looks so cute.
Oh, I think.
And Robin asked, does a facial irritate your skin?
Oh, absolutely not. A facial is very refreshing. There isn't any downtime with a facial. Even if you go a little farther with Microderm or Dermaplane, there is not any downtime. So it's a very nice service.
All right, I just want to toss it back to Pam now, because we were talking earlier also, one of the favorite things that you like to do is the Voluma to
Yes.
the cheeks. And tell everybody really what that does and how you do it.
So why I like Voluma is I feel like you can get the best correction out of Voluma. It's a product that's hyaluronic acid. As Dr. Antimarino explained, it sits on the cheekbones. So it's basically putting volume where you've lost it. As we age, we lose fat pads in our cheekbones, and that's what brings everything forward. So as soon as everybody comes in to see me, their first thing is, how do I get rid of anything down here? They want it back up here, or they'll pull up here and show me where they want product. So that's why my go-to is Voluma. It sits on the cheekbones, it creates volume, puts it back where you lost it naturally, gives you that nice, natural, youthful look. And it lasts approximately 2 years.
Have you had very many people ask about filler in the chin area? I read an article that's an area of aging that people don't address necessarily, but filling in like the little lines below the lips and above the chin?
Yes, there's 2 products you can use in the chin area. You can use Juvederm and you can use Volbella. Juvederm is thicker and it can bring down the jawline a little bit to make that a little smoother there, because some people get an indentation there. Also here, the little lower lines, the superficial lines, we use Volbella, and basically it just smooths that out. So it gives it a nice, like, soft look on the surface.
Now, I know we were talking about a facelift earlier. Does that affect, so would you still be getting fillers then? I know you briefly touched on that. So would those fillers still be used for different areas like the mouth when you have?
Yeah, because the facelifts, some of the things that people want to, I guess they think that a facelift would correct. Things that women really get more than men are the little lines around the top part of the upper lip, and there's sort of these vertical lines, and it's sort of the holy grail of plastic surgery, I like to call it, because there's really nothing that treats it very well. We can soften it, but we can't completely correct it. So there are some people that will come in thinking that if you did a facelift and you pulled all this back, that it would somehow smooth out the upper lip, and it really doesn't. So in that case, adding volume to the lip using Juvederm or Botox or Botox to the upper lip to kind of help soften that, the pull of that muscle around the mouth will help decrease those lines. And remember, a facelift is going to soften your look. It's going to rejuvenate you. So as we age, as Tara was saying, you know, the skin isn't the only problem when we age. There's a layer just above the muscle, and there's a lot of infomercials about the laxity of the facial muscles that are causing the aging look, and that has nothing, aging has nothing to do with the muscles of the face. There's a layer between the skin and the muscles, and it's this little fibrofatty layer, and that's what slides down and forward. And so as people come in and they get a little bit older, they start to see some thickening of tissue here, and the cheek that used to be here is now here. And you can see it a little bit on me, and that helps kind of deepen that crease here. So as you do a facelift and you reset that layer and then pull out the extra skin, it's a 2-layer correction for a facelift, you might still have some fold here that you might want to continue to soften. And that's where Juvederm really is beneficial after a facelift. And again, Botox is really something, especially around the crow's feet and the forehead.
Melissa wants to know, is it possible to get a filler or injectable above my eyebrows to get a lift? I feel I have a lot of skin or droop in that area.
Above the eyebrow?
I'll kick that one over to Pam because she's very good at that.
Above the eyebrow, if there's excess skin and you have a lot of muscle movement, you can use Botox there. I don't believe I've ever used filler. Now, I have used it in the little 11s. If you relax it with Botox, and some people, you still see the 11 lines there because there's an indentation there. I have used a very super thin filler and filled that area in.
Right. Particularly, most people don't need filler up in this area. It's mostly because of the muscle pull. And sometimes as we get older, sometimes the eyebrows start to move down. And you can lift it a little bit with Botox, but sometimes you really need, especially for women, the outer part of your eyebrow can be lifted and really opening up that side of your eye to take care of some of the wrinkles you're developing here, and it opens it up and actually makes your eyes look bigger. And the only way to do that is to do some type of a brow lift, either with an endoscope or with an incision near the hairline to really pull up that outside eyebrow. But I think in that area, I agree, I don't think fillers would work very well in that area.
I have a couple questions that are coming into Tara. Aaron asks, what is microneedling? And Sarah asks, with the various facial services offered, how often do you recommend microneedling for best results?
Well, it kind of depends on what you want out of the microneedling. The microneedling, if you have correction with texture, I'm probably going to tell you to come every 6 to 8 weeks, and it depends in a row, and it depends on what you're trying to correct as to how many times. If you're just looking for anti-aging and collagen boosting, I'll probably have you come 3 times a year, but I will have you on special products and other types of resurfacing. And Mike, what was the other question?
What is microneedling?
So microneedling, it's a device that I use. We numb your skin first, and it's a series of needles that actually create a wound, and then you trick your skin into healing. So it boosts collagen, regrows skin for acne scarring. It has many great benefits. It's very nice.
And there's not much downtime with that. So what do you normally, what's your post-procedure care so that they understand that?
Well, you cannot use makeup for about 24 hours. After that, you can use powder, and that's about all.
Is it painful? You said
No, we numb the skin. So.
And you said before, I think when we did a live Facebook a month or two ago, it was a month ago, we did the microneedling where you actually showed it, and they're just so almost like they have a sunburn afterwards, right?
Yes, in a few hours, yes. And then you will have some flaking, which that's what we want. We want cell turnover. And that's about 5 days. Day 6 is my favorite. That's when you're glowy and it looks vibrant, it looks beautiful.
Is that one of your favorite procedures?
It actually is. I do. I love the results. It just feels wonderful.
Jamie says, great job, guys. And I think we're going to Pam. Let's hear some things from Pam. What's your favorite procedure, Pam?
As I said, I do like Voluma. I feel like that's a great product, and you can get great results out of that. My other favorite thing to do is lips. Lips are in right now, and everybody's lips are different. You can change the shape of your lips. You can keep the same shape, just make them larger, more defined. And I think for Valentine's Day, we're running a special, so everybody check out our specials and come in for some lips.
I think one of the things that I find with women over 50, they think lips are for a younger crowd. And I think some of the products that they're not aware of that it's a more soft, refined look. It's not the big pouty lips.
Yes, you can use a syringe of Juvederm and get a very nice natural look out of it. You can almost walk out of the office and only you would be able to tell that you had your lips done. So we can do that. It looks very natural without the big pouty lip.
Right. I think I think for a while there, plastic surgery was almost a one size fits a lot of people, and our population of patients varies from ladies in their 20s all the way into their 70s and 80s, and we have men coming in, not so much for their lips obviously, but for men coming in for facial rejuvenation, for facelifts and eyelid surgery. It's becoming actually more popular in my practice than even liposuction. So it's a big change in what I'm seeing in the dynamics of my practice. But again, everybody's different. Everybody, as we say, our tagline is your partner defining you. Everybody's different. Everybody has a different goal. So especially women over the age of 50 and that are coming in that have had, gone through some menopause or going through menopause, and they're losing some volume. It's not so much, you don't want to get those big lips. You want to just define what they have. One of my favorite things that you do is the eyebrows with the microblading. And, just again, it's a soft look, but it enhances a woman's eyes. And the lips, we were talking about a couple of the patients you did today, just that nice curve. It just sets it off that people wouldn't know you did it because it's such a subtle look, but it enhances so much that it really gives them confidence, and it kind of reestablishes without people looking at it like, wow, what did you do to yourself?
Right.
Amy says you're going to be doing her lips, Pam. And Jamie says, Pam does a great job on lips. I love her results. Had mine done in late December. Very happy.
Thank you. What I love too is some women will come in and their first thing they say is, I would like my lips done, but I don't want them to look like they're done. And then another thing they tell me is when they smile, they lose that upper lip. So that's very common. And we can put a little filler in there so when you smile, you have your natural lip back. It doesn't disappear.
Liz asks, when you get your lips done, is there a certain standard for lips? For example, are the top lip and bottom lip supposed to be the same size?
I always go with the ratio of 30-40. So your top lip should be 30, your bottom lip 40. So just a little bit bigger than the bottom lip, a little bit bigger than the top lip.
Sarah asks, is there anything that can be done under the eyes as far as so they don't look as tired under the eyes, as far as fillers?
There are fillers that can go underneath the eyes, and it's called in the tear troughs. And it's one little, little prick that we use, and you use a cannula and you just lay filler underneath the eye to give it more volume under there, and that lessens the darkness and the shadowing underneath the eye. Makes it a nice smooth underneath.
Thanks, Sarah. We love having all the questions you're sending in. She said to tell you all you're amazing. You all do great work.
Thanks, Sarah.
Thank you. And don't forget to keep commenting and asking questions because you can win a facial.
We're getting back to the eyes because that's another area of common interest for all three of us, because ladies will be coming in, and a lot of times they'll either talk about the puffiness of their eyes or the bulges below the eyes making them look tired. There's also, as we just addressed, some of that can be some hollowing of the eyes, and that makes somebody look older than they are. It's the hollowing. And there's two different treatments for both of those. The other thing that I think I kind of pitch over to Tara a lot is the crepiness of the skin also, and that's one thing that ladies really complain about. Men don't really have that problem with the crepiness of the skin, but men usually get bulges, that real wrinkly skin because they get too much skin. And for men, most of the time, the best thing to do is an eyelid surgery. But with the crepiness of the skin, if somebody has some hollowing of the lower eyelid, and so they don't have enough fat there, one of the things that I like to do is put a little bit of fat in there, not much, but a little bit. And there's some idea that with the stem cells that you're transferring with the fat, that it can actually help treat the crepiness of the skin, and the skin becomes a little bit thicker and stimulates the collagen of the dermis. But that's sort of, a hard thing to treat. And so, Tara, you kind of, we kind of kick them over to use, patients over to use sometimes for maybe a laser or maybe microneedling or something to stimulate it. But comment about what you...
Can you laser under the eyes?
We do have a laser that you can get pretty close under the eyes. So our circulation sometimes can cause darkness also. And if that's the case, our laser works really well because it works on the circulation under the skin. So that will help. Also, our laser also does a little bit of skin tightening. So that's nice also. Any type of resurfacing is nice because sometimes that crepiness is actually dry skin. A lot of times we see flaky skin and we just think that we're dry, and it gets really crepey, especially in the winter months. So if we deeply exfoliate that skin, a lot of times it's very smooth, and that's all you need.
Robin wants to know, do you do all these services at all the locations?
Great question. Yeah, we do. All of the spa services that we're talking about are for Monroeville and in Shadyside. So whatever we do in one office, we can do in the other. In our satellite offices, we do mostly dermal fillers, Botox, and then I see patients for pre and post. But we have Tara set up at both main offices to do all of the other, the lasering, all the microdermabrasion, the eyebrows, everything else can be done in our two main offices.
Amy asks, going back to the fat transfer under the eyes, what's the downtime on a fat transfer procedure under the eyes?
The downtime is about somewhere around about a week to 2 weeks. There is a small chance you would get some bruising. Again, as Pam was talking about before, you can make a small little injection point with a needle, and then you can use a very thin cannula and go through one spot right here in the cheek and get up underneath there. So there's only one area that you have to enter, and then you just lay the fat in there. And the fat is very fine. You use a very fine cannula, so the chance of getting lumpiness is very small. But that area has a lot of blood supply to it, so there's a small chance you would get some bruising. I usually have patients taking Arnica montana, a little herb, about a week prior to surgery, and eating fresh pineapple also helps the downtime. But this is an area that you do not want to rub after surgery or use ice, because that would restrict the blood flow. So things that you would normally use to decrease bruising, you can't use when you do a fat transfer.
This question's for you, Tara. Lindsay asks, since my daughter was born 4.5 years ago, I've noticed I have an orange peel-like texture to my cheeks as well as a redness to my complexion. What do you recommend I do to rectify this?
Well, usually when you see an orange peel skin texture, usually you're excessively oily. So I would probably put you on a regimen of salicylic acid, benzoyl peroxide. I would have to see you first to correct that.
Microneedling can help.
Yeah, the texture also, because the orange peel basically is the pores are very large, so they're probably congested a little bit. So I'd probably have to see her, but we definitely have a lot of things here we could help her with to smooth that out.
Danielle wants to know, will you discuss microblading? What exactly is microblading?
So microblading is a semi-permanent tattoo, I use a blade that I make hair-like structures. It's very natural, so it looks just like your eyebrow. It's actually really amazing. You can hardly tell the difference between your hair and the actual tattoo. It usually lasts 1 to 3 years. It's a 2-part procedure. You get the initial visit, and then 6 weeks from there, you get a touch-up, and it's beautiful.
Riley says, all of you are awesome.
Thanks, Riley.
Tracy wants to know, my skin is drooping over my eyelids and affecting my vision. Is there a filler of some type, or is that a surgical procedure?
Yeah, that's going to be a surgical procedure, and especially if they're hanging over that much, where they're touching your eyelashes or even over your eyelashes, I would recommend you see your optometrist or your ophthalmologist. There's a test that they can do called a visual field test, and they'll have you look through a screen, and they'll look and see how your peripheral vision is. And if there's some blockage there because you have so much hooding, then that's can be a detriment for driving a car. So at that point, if that's positive, we can actually submit that to your insurance company for them to take care of that upper blepharoplasty or the upper eyelid surgery.
Sherry D'Angelo said to tell everyone hello, and Chanel said, working aside these 3 providers every day has been a dream come true. You can't find a better surgeon, esthetician, and injector.
Aw,
Thanks, Chanel.
Thanks,
Sherry.
So, Dr. Antimarino, what do you find to be your favorite procedure?
Well, the eyes and the face are becoming very, very popular for me, and I really enjoy doing them. Classically, I've always enjoyed doing breast surgery and combining that with some type of belly procedure, either liposuction or tummy tuck. Especially for the patients that are coming in for that are almost always moms or ladies that have lost weight for one reason or another, and they just really want to get back that natural look. They want to have a natural shape and better balance. They want to fit in their clothing, and what a lot of them talk about is confidence. They've lost confidence. They don't feel confident in their clothing, and for me, creating that balance is such a challenge. I just love doing it. There are different styles of implants that you can choose from. So everybody comes in, and for me, I can really look at them, kind of see where I want them to go, and then really sculpt out their belly, putting it back to a pre-pregnancy form, or just taking away the extra skin from all the weight loss and really putting them in a situation where clothing options are up to their choice. I want to see them being able to go out and really get out and do the things they want to do and not be held back because of their clothing options. So for me, that is so rewarding, and I love it when patients come in and say, I have so much confidence in the way I look and feel now. So those are the 2, face and eyes, and then the contour of the torso, really the breast and the belly.
I know you mentioned mommy makeovers, but what about women going through menopause and watching their body change and some of the fat deposits that accumulate? Do you find that that's...
It's, as I've gotten older and my population of patients has changed with me more, I'm seeing something that I hadn't seen earlier in my career, but ladies are coming in, and I see a common thread, and a lot of them are saying, I weigh the same, or very similar to the way to what I weighed 5 years ago, but my clothes don't fit the same. My body has changed, and they're frustrated over it. I mean, these ladies are taking care of themselves. They're eating well. They're going to the gym. They're running, and they cannot seem to lose the weight like they used to a few years ago. And we see it with guys as our testosterone drops over time, as our metabolism slows, we get a little paunchy. But with women, they're really trying to do stuff, and they've actually taken more of an effort to get back to that body that they used to have, and they can't get there. And what I'm finding is that ladies are having more kind of fibrofatty tissue in the upper part of their belly. And it's different than the lower part. And a lot of them will come in and they'll sit down and they'll say, this is kind of bulging up under my ribs. It's uncomfortable. I hate sitting down. It just doesn't fit right. It's up underneath my ribs. And it can even be painful. And then I have them feel the lower part of their belly, which is that fatty tissue, is very soft, and up on the top is much more fibrous and much more rigid. So in that case, when it's very amenable to liposuction and removing that. Some of those are the happiest women in the practice. They come in and saying, I just feel so much better. Just sitting down without that bulge. And they don't want to eat because it already makes them feel full as they sit down. So I'm seeing that, and I'm seeing that in women in their late 40s through their mid 50s. And so the only thing I can think of is it's really in that hormonal changes around menopause and perimenopause that's changing their body. And honestly, there's really not a whole lot you can do about it. I've had women try all these different diets, different ways to eat, different exercising, and it just doesn't help on the majority, at least the women that I'm seeing. And so liposuction has been a great correction for that.
Amy says muffin top, ugh.
The muffin top's a little different because that's down. That's
the back.
Guys get muffin tops, but this is above the belly button, between the belly button and the ribs. But yes, muffin tops are not fun either.
Liz wants to know, is there any treatment you can get for stretch marks?
Well, you can if they're a purplish red color. We can use laser. If they're thick in the texture, we can use microneedling. But otherwise, if what you can.
Yeah, sometimes if it's in the, again,
Cut it off.
moms that are coming in after children or weight loss, if it's really below between the belly button and the pubic area, we can remove that with a tummy tuck. There's a lot of myths about stretch marks. I think there's going to be a lot of ladies that are watching that if I tell you, that cocoa butter doesn't do anything to prevent stretch marks, and you're thinking, oh my gosh, I rubbed tubs of it on myself when I was pregnant. If you're prone to getting stretch marks, you're going to get stretch marks. And that's really a fracturing of the skin on the inside out. So when you get cut and you cut from the epidermis down to the dermis, you can see that skin split. A stretch mark is actually a cut in the opposite direction. So when you're pregnant and you gain weight really fast or the baby's growing very rapidly, you actually fracture the dermis, the thick part of the skin underneath, and you fracture that, but it doesn't fracture the epidermis. So it doesn't actually tear the skin, it just tears it a little bit on the inside. And that's where you get that sort of that cavernous look, that stretch, that valley, because the dermis has now been fractured, and so you actually heal that with scar tissue, so you get that little bit of an indention. There's really nothing that's going to make that go away completely, but there are some things that we can do to help soften the look of it.
Yeah.
Those are great questions, by the way.
Well, are you ready to choose a winner?
Are we out of questions? We're going strong here. So.
Can we pick a number? Would you like to pick a number, Dr. Antimarino?
Let's take number 9.
Number 9 is Sarah.
Sarah.
All right, so congratulations.
Oh, we've had some. Oh, and Carrie says, I can't say enough good things about you and your staff and what you have done for me. And Sherry says, oh, great, another lovely effect of menopause. Aren't women lucky?
Yeah.
Thank goodness for a plastic surgeon who is blessed with skillful hands to make us look better.
Oh, exactly.
Well, thank you very much.
So we just need Sarah. She's got a minute to respond. And there she is.
Congratulations.
Sarah, you won. Sarah Casimir.
Yay.
Can you message us?
Oh, okay. So, Sarah, you need to message us if you haven't done that yet. But listen, thank you so much for all the comments and the questions tonight. This was a lot of fun. We'll do this in the future. So we'll let you know. We'll be doing it again next month. And if you have any further questions or any information that you want, please visit our website, www.bellissimoplasticsurgery.com. You can also follow us on Twitter and Instagram and Facebook. And I want to say thank you to Tara and Pamela for staying late tonight with me and giving me some good ideas. And so we'll be seeing you guys in a month, and hopefully you'll stay tuned in.